Secondary infertility is defined as the inability to conceive after you have already had at least one child. The causes for secondary infertility are varied, and in a sense they are very similar to the causes of primary infertility, or for someone who has never conceived a child. Some examples as a cause, we can find that it's simply related to age. As women get older, they have a greater likelihood of having difficulty to conceive, and certainly that can be the cause in certain cases. Additional problems that can cause secondary infertility include issues with ovulation, tubal factor infertility, meaning that there's something wrong with the fallopian tubes. We also can see secondary infertility arise from a male factor. The evaluation obviously is very important when it comes to secondary infertility because that can help direct our care of you. Evaluations might include information that will let us know whether or not you are ovulating, examinations that will help us determine whether or not your fallopian tubes are open, and even perhaps a semen analysis to let us know whether or not there is a male factor. Once we have performed this evaluation and can better evaluate your cause of secondary infertility, we can make the best choice in terms of treatment. Options for treatment of secondary infertility are obviously very dependent on the cause of the secondary infertility. Once evaluation has been performed, we can make the best choice for you. For example, if we find that you have issues related to ovulation, we can consider adding medications that will either increase the number of eggs you ovulate on a monthly basis, or perhaps just get you to ovulate. If we find that there is an issue related to the tubes, we may need to do surgery, or perhaps move to something like in vitro fertilization. If we find that there's a male factor involved, we may be able to do something called an insemination, or use advanced technologies like in vitro fertilization.